Hi, friends. Did you know May is Mental Health Awareness Month? It's a time where we shine a light on something that's often invisible, yet affects millions of us every single day. So, today, let's take a few minutes to talk about mental health, what it is, what can go wrong, and how healing is absolutely possible.
Mental health is a crucial part of overall well-being. It encompasses our emotional, psychological, and social wellness, affecting how we think, feel, act, manage stress, relate to others, and make choices throughout our lives. Mental health is not just the absence of mental illness. It is a state of well-being that enables people to cope with life's stresses, realize their abilities, learn and work productively, and contribute to their communities. Why mental health matters. It helps us handle stress and adversity. It supports healthy relationships and meaningful contributions to society. It impacts physical health, with mental disorders increasing the risk for conditions like heart disease and diabetes. Common mental health disorders. Mental health conditions are widespread and can affect anyone, regardless of age, gender, or background. In the United States, about 1 in 5 adults experiences a mental illness each year, and almost half will experience a mental health episode in their lifetime. The most commonly diagnosed mental health problems include anxiety disorders, including generalized anxiety disorder, panic disorder, social anxiety disorder, major depressive disorder, MDD, post-traumatic stress disorder, PTSD, substance use disorders, such as opioid dependence, autism, spectrum disorders, attention deficit, hyperactivity disorder, ADHD in children. Prevalence. Anxiety disorders are the most common, affecting over 40 million Americans. Depression affects more than 322 million people worldwide. Many people experience more than one mental health condition at the same time. Causes and risk factors. Mental health conditions can result from a complex mix of factors: biological, genetics, brain chemistry, and physical health, psychological, trauma, abuse, and adverse life experiences, social and environmental, poverty, violence, discrimination, and inequality. Recognizing symptoms. Symptoms vary by condition, but may include persistent sadness or irritability, excessive worry or fear, withdrawal from social activities, changes in sleep or appetite, difficulty concentrating, substance misuse, thoughts of self-harm or suicide. If you or someone you know is experiencing these symptoms, seeking help early is vital. Treatments for common mental health problems. Effective treatments are available for most mental health conditions. The most successful approaches often combine several strategies tailored to the individual. Anxiety disorders. Symptoms: excessive worry, restlessness, fatigue, difficulty concentrating, irritability, sleep disturbances. Treatments: psychotherapy. Cognitive behavioral therapy, CBT, is the gold standard. It helps people identify and change negative thought patterns and behaviors. Medications. Antidepressants, such as SSRIs and SNRIs, and in some cases, benzodiazepines for short-term relief. Lifestyle changes, regular exercise, stress management techniques, and reducing caffeine, alcohol. Online therapies. Digital CBT and other e-therapies can be effective and accessible. For mild anxiety, your health professional might suggest lifestyle changes, such as regular physical exercise and reducing your stress levels. For moderate to severe anxiety, psychological or medical treatments, or both, are likely to be recommended. Major depressive disorder, depression, symptom: persistent sadness, loss of interest in activities, changes in appetite or weight, sleep problems, fatigue, feelings of worthlessness, difficulty concentrating, thoughts of death or suicide. Treatments: psychotherapy, CBT, and other forms of talk therapy are effective. Interpersonal therapy and behavioral activation are also used. Medications: SSRIs, fluoxetine, sertraline, citalopram, escitalopram, paroxetine, fluvoxamine. SNRIs, venlafaxine, duloxetine, desvenlafaxine. Atypical antidepressants: bupropion, mirtazapine. Others: tricyclic antidepressants, TCAs, monoamine oxidase inhibitors, MAOIs, usually reserved for cases resistant to other treatments due to side effects. Combination therapy: using both medication and psychotherapy is often more effective than either alone. Electroconvulsive therapy, ECT, for severe or treatment-resistant depression. Lifestyle modifications: regular physical activity, healthy diet, sleep hygiene, and social support. Post-traumatic stress disorder, PTSD. Symptoms: intrusive memories, flashbacks, avoidance of reminders, negative changes in mood and thinking, heightened reactions. Treatments: trauma-focused psychotherapy, CBT, eye movement, desensitization and reprocessing, EMDR. Medications: SSRIs and SNRIs. Support groups: peer support can be very helpful. Substance use disorders. Symptoms: compulsive use of substances despite harmful consequences. Withdrawal symptoms. Tolerance. Treatment: detoxification and medical supervision for withdrawal management. Medication-assisted treatment: methadone, buprenorphine, naltrexone for opioid dependence. Behavioral therapies, CBT, motivational interviewing, contingency management. Support groups: 12-step programs and peer support. Autism spectrum disorders. Symptoms: difficulties with social interaction, communication challenges, repetitive behaviors. Treatments: behavioral interventions, applied behavior analysis, ABA, social skills training, speech and occupational therapy to improve communication and daily living skills. Educational support: individualized education plans, IEPs, ADHD in children and adults. Symptoms: inattention, hyperactivity, impulsivity. Treatments: medications, stimulants, methylphenidate, amphetamines, non-stimulants, atomoxetine. Behavioral therapy, parent training, classroom interventions, educational support, accommodations at school or work. The importance of early intervention, early detection, and treatment can greatly improve outcomes. Many people delay seeking help due to stigma, lack of awareness, or limited access to care. However, most mental health conditions respond well to treatment, and many people recover completely or can manage their symptoms effectively. Combining treatments. Medication and therapy research shows that combining medication and therapy can be especially effective for conditions like depression and anxiety. Medication can help reduce symptoms, while therapy teaches coping skills and addresses underlying issues. This approach can improve outcomes and lower the risk of relapse. Combining both treatments can improve symptom management. Medication can help reduce symptoms, while therapy can teach you skills to manage them. This combination can be especially effective for conditions like depression and anxiety, where medication alone may not be enough. Self-care and lifestyle strategies. Alongside professional treatment, self-care plays a vital role in mental health, Regular exercise boosts mood and reduces anxiety. Healthy diet supports brain health. Adequate sleep, essential for emotional regulation. Stress management, mindfulness, meditation, and relaxation techniques. Social connection, maintaining relationships and seeking support. Reducing stigma and promoting recovery. Stigma and discrimination can prevent people from seeking help. It's important to remember, mental health conditions are common and treatable. Recovery is possible, and many people live full, productive lives after treatment. Support from family, friends, and community can make a significant difference. When to seek help if you or someone you know is struggling with mental health symptoms that interfere with daily life, relationships, or work, it's time to reach out. Start by talking to your primary care provider or a mental health professional. In a crisis, contact emergency services or a suicide prevention helpline. Conclusion: mental health is just as important as physical health. Understanding common mental health conditions, recognizing symptoms, and knowing about effective treatments can help reduce stigma and encourage people to seek the help they need. With the right support, most people with mental health conditions can recover or manage their symptoms and lead fulfilling lives.